Now, with all of this in mind, you're also going to do it this way, with the elbows up and down this way. And she has to keep the elbow as high as possible. She's going to push this hand in, down, push as hard as you can, 1,000, 2,000, 4,000, 5,000, 6,000, relax. And the next step is to raise the elbows a little bit higher and bring the hands in. So you're raising the elbows higher and bringing the hands in. You can see on this elbow it's still a little bit of difficulty in that shoulder. It's only been a month, so it's still in pretty good shape. Now, the one thing that you may find is, no matter how much range of motion you get, this particular muscle in here, the deltoid muscle, is where the shoulder bone is hanging. Basically, that shoulder joint is comprised of a bone that's hanging in space, literally, pulling down, hanging in space, and being supported by a number of muscles that hold it into place. One of those main muscles is that deltoid muscle here. Unfortunately, because of the nature of the human body, that deltoid, after your procedure, is still under a lot of stress because of the fact that it's holding the arm up. And because of that, it's the last one to heal. And unfortunately, fortunately, in many cases, it heals completely, and within 6 weeks, there's no residual after effect, and you have full range of motion, full strength, and no pain. In a number of cases, however, you may have some slight residual pain in this region right here, and it may last up to 6 months, but it will go away, so do not fear. One of the things you can do for that, Lisa's going to show you right now, is a ball that she is going to, you can use that ball first. She's going to show you what to do with this ball. It's a very simple procedure. All you need is a tennis ball. Very easy. You see how she's rolling up and down on that ball on the wall, exactly in the places where she feels like it needs to be done. So she's going to feel, ooh, that's good pain right there. I think I want to just press on that area a little bit more. There will be specific sweet spots that you're going to feel where it seems as if it's painful, but it's kind of a good pain, as we call it, a sweet pain. That's the area that you're going to use the ball on. And you can see she's moving it around right now. There's specific areas that she feels that she really needs it. There may be areas in the back, and maybe areas in the side, even areas in the front. You can use that ball just about in every way. Now, in addition to the way she's holding it right now, when she gets in this position, she can also raise the arm, and she can do movements this way while she's on that ball, which also enable, because these are the actual movements of the muscle that she's on right now. These are the movements that that particular muscle does. Okay? She can even put the ball on the inside of her arm in here, and she can move her arm down and around, holding the ball in and moving it this way. That's right, around and backward and forward this way as well, keeping the ball on the inside of her arm. Now, she can also even push that ball into the inside of her arm and do those motions. Push it right up into the underpit. There you go, into the underpit, and do those motions, because there is something called a subscapular bursa, which sticks together in the underside of the arm that often causes restricted motion in cases of frozen shoulder. Okay? Now, Lisa, is also going to show you another ball-type device here. And this is, now, if you have trouble raising your arm or lowering it, you can stimulate the nerve sensors inside the muscle with what we refer to as a basic sort of vibrational stretch reflex. What this vibrational stretch reflex does is, when you're actually hitting the muscle, you're stretching specific receptors very, very quickly that cause contraction of the muscle and enable, much like a knee-jerk reaction, when the doctor hits your knee, the muscles here contract. It's a reflex that occurs. She's creating a constant barrage of that reflex, which causes a recruitment of signals into the muscle, strengthening the muscle and enabling her to actually lift and lower her arm through concentric and eccentric contraction, upward and downward movement, much easier than she would if she were not stimulating it with this ball. So, by the way, all of this equipment that you see here today, you're able to purchase through our website, frozenshoulder.ca, not .com, frozenshoulder.ca for Canada, and you can get all of that. Now, Lisa's going to show you this wonderful device. She's going to show you how to use this, and it's called the stick. The stick, okay? Now, you can see there's all different ranges of motion that she uses with the shoulder, which is wonderful for that particular area that often creates intractable. Now, let's Yeah, let's show the camera by turning yourself around a little bit here. And you can see this stick actually bends a little bit and moves into those areas that are some of the muscles which comprise what we refer to as the rotator cuff. There's 4 muscles that comprise the rotator cuff, and those 4 muscles all help to hold the head of the humerus, or the arm bone, into the socket. They also are responsible for lifting the arm and rotating the arm in specific outward and inward directions.
Feels good.
She's enjoying it. Okay, you can enjoy it too. The stick. Now this device here is, it's not really that expensive when you think about what it does, although it may be, between $200 to $300. However, certainly the most expensive of the equipment that we have. It is wonderful. It is a wonderful device. It's called the Thumper. And this particular device will put a vibrational sense into the muscle, which causes nerve reflexes that enable relaxation. It's vibrating at a specific hertz, which is consistent with the vibrational frequency that enhances muscular relaxation. And this device is using it on the shoulder. It can be used at any part of your body. So it's great for your back, it's great for your shoulder, but it's particularly good in cases of frozen shoulder. And Lisa's just going to show you some of the ways that you can do that now. Really, really good. Great. Now, there's also a stretchy band. Now, in our clinic, in the rehabilitation room at the Stretchy, we have rehabilitation devices that involve tube-like resistance bands that can be used, that are attached to the wall. But if you don't have that, you can just get one simple one like this. They're available at any fitness store, essentially, or through our website. And Lisa's going to show you basically how she uses this device for her biceps. Now, this is one of the exercises for the biceps, which is actually quite important. Okay? Quite important to do. And she tries to keep the wrist bent as she comes up. Not that easy to do. Keep the wrist bent a little more difficult. Okay. And with this particular device, there's a number of other ways that we can do this. Yeah, go ahead and do them all. You know what they are. Lisa knows what they are. I don't need to tell her. She's been doing them already quite a bit. I want to take a look at actually the weights, and then I want to get to something very simple, or simple exercise that everyone should do every day anyway, but they're called push-ups. Remember those? But these are not push-ups. These are weights that you're going to be using. Now, this again is the biceps curl. Now, with the biceps curl, you're going to start in this position here. You're going to turn the wrist this way as you come up and bring it up and over. So you're going to turn the wrist. So let's do those biceps curls and bring them up and over, keeping the elbow down. Do not lift the elbow up. And if it's hard on your back, it's probably a little too heavy for you.